As a select subcommittee gathers today, our nation faces a pivotal moment when it comes to the future of the pandemic prevention and preparedness. Thanks to the tireless work of the agencies and the individuals in those agencies sitting before us over the past 4 years, our nation overcame the darkest days of the COVID-19 pandemic and has taken meaningful strides to strengthen our public health infrastructure going forward. But the possibility of a future pandemic remains very real. Even today, we are facing emerging viruses like H5N1, which will continue to require investments of time and resources to contain. So we must keep our foot on the gas, even if it might be tempting to let up. Dr. Walke, let me begin with you. I understand an essential component of fortifying CDC's readiness for future outbreaks is providing your agency with expanded authority for robust public health data collection. Why is this reform so important, and what other reforms should Congress consider going forward to ensure your agency is best positioned to respond to emerging viruses?
Thank you for the question. Early in the pandemic, as the virus was changing, first we had the wild type, then alpha, beta, delta, and then Omicron. We had difficulty trying to understand where transmission was happening. It was difficult to integrate our laboratory data with our hospital data, with our case-based information in a way that we could actually create dashboards and make quick decisions on what to do. Some of our jurisdictions were even faxing information in around case reports. With sustained investment from Congress, we made incredible progress and pulling together that information and creating those systems so we could create that interoperability between all those various systems. But in order to keep going forward, we're going to need sustained investment in our data platforms. We have a large number of jurisdictions now who still, healthcare providers are entering information in manually actually to report case reports. We've made incredible strides in electronic case reporting, moving from 187 healthcare facilities before COVID now to over 45,000 healthcare facilities who are able to quickly give us information around case reports. So we need to continue that investment and actually improve it. We need authorities, though, as well. Early in the pandemic, early in an outbreak, before an emergency, a public health emergency is declared, we have to collect information very quickly to understand what's happening, as in COVID. And we need those policy changes to enable us to collect the information that's needed to make decisions. As where, that's a core capability related to data, but I'll stop there.
Thank you. Dr. Marson? One of the great success stories of the pandemic was the effective and efficient manner in which scientists and the FDA brought a safe and effective COVID-19 vaccine to the market and distributed throughout our nation. What lessons did FDA identify from its work on the COVID-19 vaccine, and how can Congress help to ensure these best practices remain in place for emerging public health threats going forward?
Thanks so much for that question and for your kind words about the work of the professionals at the FDA. So couldn't agree more with you. I joined the FDA in 2022, so I was an observer of that work, but really a tremendous effort. A couple of lessons that we learned. Number one, continued transparency. We have made sure that our advisory committees are airing the data that they're seeing, that we're putting out summaries of our views of our own analysis of the data that's provided by manufacturers. We do our own analysis, right? We don't just take things that are given to us. Our professionals look into the data themselves. Second, we have certainly learned a lesson, and we have taken this lesson across the FDA for various medical countermeasures, the importance of telescoping to industry, what our expectations are going to be, what sort of information that they're going to need to provide to us. So we do that in the form of guidance, and we've done it in vaccines several times, therapeutics, and diagnostics. Third is this issue of surge capacity. Our folks are incredibly dedicated, and they worked around the clock As I mentioned, that's led to backlogs, it's led to fatigue. If we had a cadre of folks who were experts in medical countermeasures during quote-unquote peacetime, they could work on those preparedness medical countermeasure development issues, and during a response could jump into action. That would be tremendously helpful for the organization.
Thank you. Let me conclude with you, Dr. Tabak. While the Select Subcommittee's efforts did not ultimately shed light on the origins of the novel coronavirus, they did underscore the importance of addressing pathways for potential pandemics both in nature and in labs. How can we balance the need for continued essential research to identify and get ahead of future viruses with the imperative that research take place safely and in a manner that is transparent to American taxpayers?
Well, as you point out, we do need to take the appropriate steps to ensure that any research of this type is done in a safe and efficient manner. But I think we do need to continue the long-term investment in basic discovery, because without the fundamental knowledge of, for example, the different viral families for which we have less information, we would be working blind should one of those escape to be a new emergent pathogen. We also have to continue to build on the infrastructure that we have in place to ensure that we are ready for the next pandemic, and that includes things like pathogen surveillance and genomic sequencing and informatics and structural biology, so that we have better understanding of what potential targets might be. And finally, we have to maintain a flexible domestic and global clinical trial network infrastructure so that we can rapidly deploy potential countermeasures and test them for their efficacy.
And what would the ramifications be of cutting funding to NIH for this and other essential research as a knee-jerk reaction to the possibility that the novel coronavirus emerged from a lab incident?
The need for basic discovery is essential. We need to understand who the pathogens are. We need to understand how the pathogens transmit. We need to understand what their mechanisms of action are, what type of disease, what pathology they cause, and we need to support the key infrastructure that is essential going forward if we're to successfully defeat any emergent pathogen.
Okay, I'm pretty confident that our own labs could attain that level of security. The question is, how do we work with adversarial countries to ensure that they're not, that they're up to code and they're transparent?
As you know, international collaboration and research is essential, and the pandemic underscored that. But unfortunately, when there are instances of non-cooperation, we have to, call that out and hopefully work, through both diplomatic and other channels to try and bring those organizations into a more favorable compliance.
Thank you. Dr. Walke, you mentioned earlier that having investments in personnel in other countries is very important to be able to monitor any emerging virus. In your opinion, do we have we mapped the high-risk animal-to-human potential transmission locations? Are we in the right places?
Thank you for the question. Related to emerging threats, there's a lot of work being done, both within CDC and public health agencies, as well as the academic world, around where the next emerging threat might be. There's a number of issues here related to deforestation, for example, and population movements. But we do have staff actually in most of these areas, for example, in South America or in Africa, where we're seeing some of these emerging threats. We also place our staff where there's a large burden of disease, for example, HIV or malaria. or tuberculosis. So there's a number of different criteria when we make decisions about where to put our staff. But as you have said, it's incredibly important to actually have that face-to-face, people on the ground working side by side with ministries of health, because when something happens, actually they then work with our staff and ask for technical assistance, and we're actually able to have that partnership.
In what other ways, in addition to technical assistance, are we building the host country's capacity to identify any emerging viruses and to better respond to those emerging viruses, to contain it there?
In a similar way that we're trying to build capacity in this country in data and analytics and laboratory capacity, that trained public health workforce, and for domestic and global response, we do similar things actually in other countries. We embed within the laboratories and try to make sure that they have the validated assays available. We work with their data systems to make sure they can connect with each other. We actually train their field epidemiologists so that they can know how to go out and collect the information to understand the transmission of these pathogens.
Well, I really appreciate all of you. Thank you, all of you individually, for your tireless work for our government, for the American people. Thank you for your work during the pandemic, and thank you for being here. I yield back.